Well, as we reported to you, new fears that early fall could bring with it a second wave of the China virus and more deaths, of course. Fears that caused a major sell-off today on Wall Street. But when compared to the actual numbers this spring, the new predictions, well, they're somewhat concerning. The University of Washington model that predicts that deaths will decline in June and July and remain flat in August, but then rise again in September and October has been controversial. The model also predicted that by October 1st, daily deaths will hit more than 1,000 Americans. But that number falls well below the previous high daily death toll in the United States, almost 2,300 back on April 15th. So we have a lot to answer, and for that we have turned to two folks I can't wait to talk to. Joining us tonight is Fox News medical correspondent Dr. Marc Sigel and Alex Berenson, former New York Times journalist and author. Amazon briefly, by the way, blocked the sale of his new book, but then repented when they heard from Elon Musk. Unreported Truths About COVID-19 and Lockdowns, the title. It's now third on Amazon's bestseller charts, and we would recommend that you read the book, and in so doing, drive the book even higher on that chart. Alex, good to have you with us, and let me start with you. You must have a warm spot in your heart for both Amazon and Elon Musk.
I don't have such a warm spot for Amazon, although the controversy obviously, got some attention for the book. Amazon is a monopolist, basically, when it comes to books. They're incredibly dominant on the sales side, and they've benefited tremendously from these lockdowns. The stock, well, not today anymore, but it was at an all-time high, as of yesterday, and right. So it is up to them. It is incumbent upon them not to censor, not to hide views that they may not like or might not help their corporate position. And I know that my book is not the only one that they have tried to censor.
Yeah, we could go down that. The left in this country right now is trying to censor and cancel and stultify every voice that is counter to their narrative and ideology, as you well know. We can have that discussion another day. I want to turn first, Mark, if I may, on the issue of the China virus. Is this damn thing going to come back in a second wave? Does Dr. Fauci have a clue what he is talking about? And if he does, tell us the correct statements and separate them from the bizarre statements.
Well, I think that kind of saber rattling is inappropriate. By the way, they should rename Alex's book. Amazon says if you end the lockdowns, you might be able to social distance at a bookstore and buy Alex's book there, right? As far as this point about the lockdowns,
well, it's a hell of a subtitle, at least.
Lou, listen. This virus came upon us so suddenly, and it was panic that caused the lockdowns in the first place. It doesn't make public health sense because the virus is riddled through the communities, and then you lock it down, and the virus spreads more within the communities. And there's no travel bans in place that prevents people from coming in. In Australia and New Zealand, they never had these number of cases because they closed the borders the way the president wanted to do here and wasn't able to do. So now you have a situation where we're finally starting to open up, and yes, we're doing more testing, which shows that there's more cases in certain areas, but you're not seeing more hospitalizations, you're not seeing more deaths. The Wall Street Journal pointed to Wisconsin
I'm sorry, Mark, in some states we are seeing more. I think it's too early.
Yes, more testing.
It's my guess. It's too early to make. Okay,
Lou,
Alex, your thoughts?
Sure.
How far?
Yeah, my thoughts are it's quite possible we'll see a quote-unquote second wave in the fall.
Yes.
This is a respiratory virus. Respiratory viruses do better in the fall and in the winter. By the way, we don't say we're on the 108th wave of the flu. We say it's flu season. Okay, and it may be coronavirus season in the fall and the winter, and we're going to have to deal with it. And we're going to have to make sure that if there are short-term, surges, that we have hospital capacity. And we're going to have to make sure that we protect nursing homes and protect people with severe comorbidities. But we can't lock the country down again. The answer to this is not to pretend that this, can't happen again. It's to talk about what we're going to do if it does. Because the CDC's best estimate on this is that 1 in 400 people who get it, on average, are going to die. Okay, that's not 1 in 10 or 1 in 50 or 1 in 100. Okay, it's not the flu either. It's more than the flu, but it isn't so much that we should panic. We need to take responsible steps.
I want to add something to this, Lou.
Doctor?
You know what works the best
Sure.
is social distancing works the best when you have a situation where the virus is throughout the community. And then there's a word called cocooning, where you protect people most at risk. Those are the people you want at home, those most at risk. And by the way, you don't admit people to nursing homes who are COVID-19 positive, Mr. Governor. You protect people who are most at risk. You isolate them. It's called cocooning. And then you social distance like they did in the state of Wisconsin. So careful reopening with social distancing in place works.
So let me ask you both very quickly, because we're out of, let's go to, we're going to have to cut it here. I want to just ask you quickly, Alex and you, Dr. Sigel, we got 15 seconds. Are we doing what's right now in this country?
No, we need
Alex?
to be reopening more aggressively, and we should especially have schools and camps open. Absolutely. To punish children because of this virus is so.
We've got you. Mark, you get the last word.
I completely agree with that. And yes, there is a seasonal quality here. And yes, we have to keep an eye on the fall, but we have to reopen aggressively. I agree.
Thank you, Mark. We appreciate it. Dr. Sigel, thank you. Alex Berenson, thank you. Look forward to talking with you again soon.